Dr. Darrick Antell is a top plastic surgeon here in New York City and a diplomat for the American Society of Plastic Surgeons. Good morning.
Good morning.
We can't talk about the specific case because we certainly don't know any of the details. But is it common in practices? We hear this one doctor say, I was concerned about complications. You need to have a clean bill of health in order to come here and get this plastic surgery. Is that fairly common?
Well, Harry, this is a devastating and tragic event, not only for the family, but for the medical team involved. People need to realize that this is surgery, and I think that sometimes people tend to denigrate it and think that it's like getting your hair done. These are real operations with real potential complications.
Right. Is it because we've seen so many reality shows and because they're shows like Nip Tuck and whatever, we assume it's something routine, and is it anything but routine?
Many of these procedures have been done for years, but they all carry risks. And even though it's in reality TV today, I think that sometimes they tend to gloss over some of the downsides of the operations. We as physicians, as members of the American Society of Plastic Surgeons, put safety first.
Right. Let's talk a little bit more about possibilities. One of the notions here is his mother was over 40. The first surgeon said, I had concerns about a complication he wouldn't divulge because of patient confidentiality. But are there certain bars that have to be met, certain thresholds that you have to feel confident of if a patient is going to have plastic surgery?
Well, to try to maximize the safety results, we recommend that people, number one, seek a board-certified plastic surgeon. Number two, the facility should be an accredited facility. Only about 10 states require accreditation. New York and California do. Number three, you should make sure that the doctor has privileges to do the operation you're considering in a hospital, even though many of them are done outside a hospital. That ensures that the doctor's undergone peer review, that their credentials are up to snuff.
Do you find within your community, because we hear these stories from time to time about dentists performing certain kinds of plastic surgery, about people who in theory have nowhere near the credentials you might have, doing things that you take quite seriously?
Well, laws are constantly evolving, and people are always getting more aggressive about what they can do. We believe that a board certification in plastic surgery is the highest level that one can achieve. And it means that you've not only gone to medical school, but you've completed at least 5 years of surgery training and then are board certified.
It's really incumbent upon the patient to do the homework. Is there a way, though, to gauge? You must be busier than ever before. Our obsession with how we look, not only our face, but our body and everything else. How do you account for it?
Well, I think that there's increasing awareness today. I also think that there is increasing safety despite this event. It's like playing sports. People break legs, they hurt themselves. 2 weeks ago, a 14-year-old was killed in Connecticut when a hockey puck hit him in the chest. That's a terrible event, but people are not going to stop playing sports, and they're not going to stop having plastic surgery.
All right. Dr. Antell, thanks very much for being with us today. I do appreciate it. Let's go back to Lonnie Quinn now for another check of the weather.